Hi, Dr. Gullberg here. Today we're going to continue our infectious disease series. Today we're going to talk about gram-positive rods. We're going to talk about aerobic rods as well as anaerobic rods. This is really a fun group of organisms to talk about. We don't see them that often, but you certainly need to be aware of them. Let's talk about gram-positive aerobes first. First group of organism is the Listeria species, but especially Listeria monocytogenes. This organism causes bacteremia and meningitis primarily, and of course, septic shock in the newborn. It's an intracellular pathogen, invades pregnant women, newborns, as I said, and alcoholics who have chronic liver disease. It's the most common people that it hits. Crinobacterium species you need to know a little about. Certainly diphtheria is a crinobacterium, and that has a potent exotoxin that it produces. Other crinobacterium infections that you're going to deal with primarily is going to be the JK strain, which is related to neutropenic fever patients who have device-related infections. And occasionally there's a crinobacterium species that causes something called erythrasma, which is a rash generally in the groin that looks like tinea cruris, but it's not susceptible to macrolides. The bacillus species are also gram-positive rods. Need to know about Bacillus anthracis, which causes anthrax, which has an anti-phagocytic capsule, produces 3 toxins: protective factor, edema factor, and lethal factor, extremely virulent. Of course, soil and animals tend to be the reservoirs for anthrax. You're not going to see a lot of it, but we may see it in bioterrorism. Bacillus cereus is an occasional pathogen that you need to know about, and the other gram-positive rod group is the Erysipelathrix species that are found in animals and on fish and can cause erysipeloid skin infections when trauma is related. So be aware of these gram-positive aerobes that are rods. Actinomyces species are gram-positive anaerobes that are rods, and actinomyces can cause lumpy jaw, which is an osteomyelitis related to the jaw, and also it's related to abdominal mycetomas, thoracic infections, and sometimes central nervous system infections. The key pathogenic factor here is looking for sulfur granules, and it can also be associated with PID from IUDs. Treatment choice is penicillin. Finally, Trophorima whipplei is an actinomycete organism that causes Whipple's disease. So again, a rare disease, but something you need to be aware of. The last organism we should talk about is Nocardia, which is also gram-positive rod. It's weakly acid-fast. It's an aerobic soil bacteria which causes pulmonary pseudotuberculosis, brain abscesses, and mycetomas in soft tissue after soil exposure or trauma. It often suppurates, and there's a lot of scarring with it. Treatment of choice is sulfa, interestingly. So these are some organisms that I want you to be conscious of. Again, a fun group of organisms to know, but we don't see them very often. Thanks, Dr. Gullberg, signing off.